In a public health consultant, Dr. Unsi Ekanem, to discuss this latest development. Good to have you join us, Dr. Ekanem. Nigeria has now kick-started the vaccination program. We've seen Dr. Ungong Cyprian being the first medical personnel to take that vaccine. What do you make of how it was rolled out and the strategy we are going to use, which is the TEACH strategy?
Yes, thank you very much for having me. I want to say that it is with a deep sense of excitement that we saw what happened today in Abuja when the first dose of the COVID-19 vaccine was administered. It shows that we are making effort in the right direction. What is important right now going forward is how these vaccines will be distributed. This is very, very important because it will determine to an extent how well we can roll out the vaccines. And with a strategy that has been aligned already by the National Primary Healthcare Development Agency, I see that we are ready to make a lot of progress in this regard to ensure that both the cold chain system is properly handled, and of course, the vaccine is equitably distributed across the 36 states in the FCT. Now, I believe that some of the vaccines have already been distributed to some of the states, or maybe all the states as we speak, so that by coming next week, we can see the rollout of the vaccine in different states, particularly for the public health workers. Already there is an online booking system for public health workers to register so that they can be vaccinated. With this strategy, like you said, the TEACH strategy, I believe that we are well on our way to rolling out one of the largest vaccination programs in the Nigerian history, in a way that everyone will have access to the vaccine.
And that's where, sorry, let me just quickly jump in, Dr. Ekanem, because everyone getting the vaccine is the most important thing, especially in this first phase, ensuring that those who actually need the vaccine the most get it. And right now, there was, I don't know if that has been resolved, but there was a squabble between the federal government and the states as to how many doses should go to several states. So how do you think that this should be resolved, and how should it be distributed within the states so that the health workers and the elderly actually do get these vaccines?
Well, the criteria here is the priority here is the health workers. And the National Primary Healthcare Center, just to let you know, the National Primary Healthcare Center, National Primary Healthcare Development Agency had already received, about a list of about 60,000 health workers across the country. These are the people that are going to receive it first. So the distribution is going to be based on the number of healthcare workers that we have in respective states. We are going to satisfy those one person across all states before we now look at the elderly. So once we are able to distribute these vaccines and have them administered to the health workers, then we can now go into the elderly. And then again, we are going to be looking at population-based. Now, the National Primary Healthcare Center has already gotten a database of most Nigerians that are above the age of 60 in most of these states, and we are going to use this data to roll out the vaccine to everyone. So, to an extent, we have resolved some of those problems, some of those challenges, and distribution is going to be based on number, not based on any political strength or political distribution.
I just want to again ask, because now that we've started rolling out the vaccine, even before the rollout of the vaccine, we've seen that nonchalant attitude of some Nigerians towards wearing face masks. When people start to take this vaccine, how do we ensure that people do not become complacent, especially in terms of following the protocol, especially now that it hasn't been proven when immunity takes place?
Yes. Yeah, part of the training that was carried out, there's been a national level training. As I speak to you, in a few days' time, the state-based and local government-based training for the health workers that will be involved in the vaccination will be rolled out. Now, part of this training involves, educating or training health workers to educate the people coming for the vaccine that, look, when you have received this vaccine, it doesn't mean that you have instant immunity. So that means you need to continue to abide by the public health, regulations against COVID-19, which includes wearing masks and, of course, social distancing and hand hygiene. So, as much as possible, the health workers that will be administering the vaccine will educate Nigerians or people coming for the vaccine that, look, until you receive the second dose of the vaccine, you have not had immunity yet. Even when you have received, for the mere fact that others have not yet received yet, you still need to abide by the regulation. We have achieved herd immunity, where 70% of the population have been immunized.
Always great talking to you, Dr. Insi Abase Akanem. Thanks for talking to us.
You're welcome.